Hi everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Knee to Know Show, I'm going to share with you some ways to progress and improve your tolerance to standing and weight bearing on one leg after knee replacement surgery. Hey everyone, so when it comes to standing on one leg after surgery, this can be really difficult because of pain, muscle weakness, and just poor tolerance to bearing all your weight through that surgical leg. Unfortunately, we have to be able to do that to do a lot of functional things like walking normally, going up and down stairs, and a variety of different activities. So here's different ways that we can progressively improve your tolerance and your ability to stand on one leg for a prolonged period of time, and that will hopefully carry over to functional activities and movements. So one way to do it is with how much support you're providing with your arms. So initially, of course, we want to start with two arms providing support. In this video, I have two chairs. You can hold on to a countertop. You can hold on to any type of sturdy surface using both hands. As you get comfortable, you want to build up the duration that you're standing on one leg. So start with maybe 10 seconds per repetition per set, and then build your way up to 15, 20. Probably the maximum is about 60 seconds. If you can maintain 60 seconds on one leg, that's really great. Another thing you can do, so from two hands, we want to go to one hand. So now we just have the one arm or the one hand providing that upper body support as you stand on one leg. From there, we can go from holding on to just providing that fingertip support. So just that tiny little bit extra help, but not gripping on fully as you do it. And then the next one is just kind of that hovering support, and then, tapping and regaining your balance if you need to, but really just kind of hovering. And then of course, going to completely with no upper body or support from the hands as you balance on one leg. Another way to build up your tolerance to standing on one leg is partially moving some weight over without moving all of your body weight over onto that one leg. So for example, I have a Airex foam pad, and so if you stand with your surgical leg on the ground and your non-surgical leg up on the Airex, you'll notice because of the instability from the Airex pad that you're going to put more weight through that surgical leg. Now it's not 100% like if you were standing with just one leg, but it's enough to start to increase how much weight you're putting and bearing through that leg. And then of course you want to start to build up that duration. Start with maybe 10-15 seconds, step off, rest a little bit, and building up to 30 seconds and up to 1 minute is probably the max. Now, standing on the foam pad, you still get a good amount of weight bearing. You can still bear a pretty good amount through that other leg. So what you would want to then do is progress to using, for example, a Dynadisc, so one of those really unsteady discs that move around a lot. And then you can also use a soccer ball or basketball or something like that. So you're going to, again, keep your surgical leg on the ground, putting your non-surgical leg up on the soccer ball. If you put too much weight through that surgical leg, you're going to lose your balance and fall off the soccer ball. So really, this is kind of basically just that very toe touch kind of balance and stability. Again, building up your duration as you go. If you don't have a soccer ball or some Airex pad or a Dynadisc, you can also just do using your tippy toe. So on the non-surgical leg, you're not just bearing weight through the whole leg, you're just keeping that tippy toe down. Again, as always, we want to start to progress where we get to the point where we can just stand on that one leg, showing that we have good balance and both good tolerance weight bearing through that leg. From there, you can go to all sorts of different variations. You can go to different star balance exercises. You can do different unilateral exercises and all sorts of fun things. But initially, it's about building up that tolerance and that stability of being on one leg. And that's going to carry over to improvements with walking, with stairs, and other functional movements. Thank you very much for watching. If you got something useful out of this, I would appreciate a like down below. Be sure to leave your comments and questions. Give these exercises a try and let me know what you think. And please subscribe if you don't already. I share all sorts of great content, everything related to knee replacement surgery, preparation, recovery, exercises, frequently asked questions, and everything else. Thank you again for watching.